Our next topic is erythema multiforme. Again, again, as I told you that in dermatology, name is very important. You can get hint from the name. So erythema multiforme, as its name indicate, its erythema means redness, multiform means many shapes. So erythema multiforme is basically redness of many shapes or many sizes. Erythema multiforme is a hypersensitivity reaction that is most commonly triggered by infections, as well as drugs can also trigger this erythema multiforme. So urticaria, it was also urticaria is also triggered by drugs, and the important drugs that can trigger urticaria, they included aspirin and opioids. Now erythema multiforme, it is also hypersensitivity reaction, and again it can be triggered by infections as well as some drugs. And the drug, and the most important drug that you need to remember for Plab 1 that can trigger erythema multiforme is penicillin, such as amoxicillin. Can somebody give me an example of a pneumonia that is associated with erythema multiforme? Anyone?
Klebsiella? Oh no, sorry, that is with alcoholic.
So mycoplasma pneumonia is associated with erythema multiforme. So what are the features of erythema multiforme? The features of erythema multiforme is that there will be target lesions. So target lesions in Plab 1, you need to remember two conditions, two diseases that are associated with target lesions. One is erythema multiforme, and the second one is erythema migrans. Erythema migrans is present in patient with Lyme disease. So erythema multiforme and Lyme disease, they are associated with target lesions. In Lyme disease, there is a single target lesion, while in erythema multiforme, there is multiple target lesions. So the first feature or the first diagnostic point for erythema multiforme is that target lesions that are initially seen on the back of hands and feet before spreading to the trunk or torso. Upper limbs are more commonly affected than the lower limbs. Pruritus is occasionally seen and is usually mild. So target lesions that initially start on the back of the hands and feet and then spread to the body. So erythema multiforme, you can say it starts from the back of the hands and feet and then it spreads to the body. Unlike other rashes such as rash in chickenpox, which starts from the face and then spread to the body, this erythema multiforme, it starts on the back of the hand or feet and then it spread to the torso. And upper limbs are more commonly affected than the lower limb. The most common cause of erythema multiforme is herpes simplex virus. It can be idiopathic sometimes. Bacteria that are associated with erythema multiforme include mycoplasma, and the drugs that you need to remember that can lead to erythema multiforme is penicillin. These are important examples that you need to remember which can trigger mycoplasma. You can see in this diagram the target lesions. See, this is a target-like lesion. This is a target-like lesion. This and all these as well. They are just like a target, And you can see that the shape of these target-like lesions, some of the target-like lesions, they are small, some are large, some are very small. So that's why it is called multiform, erythema multiforme. So target-like lesion that starts on the back of the hands and feet and then spread to the body is erythema multiforme. And if there is involvement of skin only, then it is known as erythema multiforme minor. And if mucous membranes are involved, then it is known as erythema multiforme major. So erythema multiforme major is known as major erythema multiforme when it involves the mucous membrane. And the most common mucosa that is usually involved is oral mucosa. And in about 90% of the cases, erythema multiforme major is limited to oral mucosa only. So in the Plab 1 exam, how the questions of erythema multiforme will be asked? Eruption of erythema multiforme on the back of hands, or eruption of a target lesion on the back of hands first, then on trunk and different parts of the body after sore throat. So you can add one more condition that is related to dermatology chapter, that a person can develop after a streptococcal infection, that is erythema multiforme. Gutted psoriasis, erythema multiforme, and Tyriasis rosacea. These three condition can develop, these three skin condition can develop in patient with a history of sore throat or upper respiratory tract infection. Mycoplasma pneumonia can also lead to erythema multiforme, and antibiotics for upper respiratory tract infections such as penicillin and amoxicillin, they can also lead to erythema multiforme. The management of erythema multiforme is symptomatic, that is antihistamines for itching, analgesics for pain, and local skin care. And if there is oral mucosa involvement, then soothing mouthwashes can also be used. And sometimes topical steroids may also be considered. So erythema multiforme is a redness, a target like lesion, a target like erythema that starts on the back of the hand and feet and then spreads to the body. Most common cause is herpes simplex virus, bacteria that can cause mycoplasma, erythema multiforme is mycoplasma, and the drugs that can lead to erythema multiforme is penicillin, such as amoxicillin. So remember these three causes, they are important. And the management is symptomatic. Antihistamine for allergy, analgesics for pain, skin care, and mouthwash if there is oral mucosa involvement. So this was all about erythema multiforme. Two types of erythema multiforme minor when there is only skin involvement, and major when mucosa is also involved. So this was all about erythema multiforme. I hope it's clear to everyone. If there is any question or any confusion, you can ask it.